Hey listeners, it's Lindsay Smith Rogers with some exciting news and an ask for you. The Public Health on Call podcast is coming up on 1,000 episodes. And to mark this milestone, Josh Sharfstein, Stephanie Desmon, and I are answering your questions about the show. Have you ever wanted to know how we pick topics or how our hosts prepare for interviews? Now's your opportunity to ask your question and hear your voice on the podcast. Send us your question as a voice memo to publichealthquestion@jhu.edu by October 31st. That's publichealthquestion@jhu.edu by October 31st. Thank you so much for listening, and we are excited to hear from you.
Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, a look at a recent government pronouncement that the safe and effective MMR vaccine for children be broken up into 3 separate shots for measles, mumps, and rubella, or monovalent shots that are not available in the U.S. Dr. William Moss, a Johns Hopkins vaccine expert, talks to Stephanie Desmon about how this discussion, based in part on decades-old discredited information, could further undermine confidence in routine immunization. Let's listen.
Bill Moss, thanks so much for joining me.
Thank you for having me, Stephanie.
So today I wanted to talk about what seems to be a new conversation, but it's really an old conversation. President Trump and now the acting CDC director are calling for the MMR shots, the measles, mumps, rubella shots, to be split into individual doses. And for 50 years or so, children have been given this combination vaccine that has worked really well. Let's start with what you're hearing and if it concerns you.
I must admit, I was quite shocked to hear this and see this come from first the president and then from the acting CDC director. You know, as you mentioned, the combination measles, mumps, and rubella vaccine was first licensed in 1971, and it's been a way to get very high coverage among children in the United States against all 3 of those diseases, measles, mumps, and rubella. This idea of separating the MMR combination vaccine goes back to the Andrew Wakefield days, shortly after the now discredited paper that was published in The Lancet in 1998. And it was during the press release following that publication that the lead author, Dr. Andrew Wakefield, made the claim that the MMR vaccine may be responsible for autism, something that was not studied in the paper and in the study that they conducted explicitly, but also suggested that perhaps splitting the vaccine would be appropriate. Now, there's a long story there, but he also had some financial interest in monovalent, we call them monovalent vaccines, monovalent measles, mumps, and rubella vaccines rather than the combination. So that was the last I had heard about this. We do know that at the advisory committee of immunization practices, the reconstituted committee by the Secretary of Health and Human Services after he fired all 17 previous members, did debate separating out the varicella component from the MMR component for the first dose in children younger than 4 years of age because of a slightly higher risk of febrile seizures. And that was decided upon by ACIP. As an aside, ironically, it takes away parental choice rather than gives parental choice, which is what one of the things they claim they're doing. But this idea of then further splitting the MMR vaccine, I had not heard in the discussions around the ACIP meeting or even in the measles community. And so I'm not sure who whispered this into President Trump's ear and made him say that. And I must admit, Stephanie, I thought this would just kind of blow over because those shots are not available in the United States. We don't have monovalent measles, mumps, and rubella vaccines. So it's not a recommendation that could even be put into practice. But I'm even further shocked that the acting CDC director, Jim O'Neill, kind of amplified this and gave that idea credibility.
Just to go back slightly to help people understand, there is a version of the MMR vaccine that also includes varicella, which is chickenpox. Is it commonly used or is it not quite widespread?
It's not commonly used. The numbers are about, maybe 15% of children get the MMRV combination vaccine and the other 85%, split it out. The CDC way back in 2009 actually changed their recommendation to be that they preferred the split, actually splitting the MMR and the varicella components because of this increased risk of febrile seizures. It's still rare, but maybe approximately doubles the risk. But the CDC recommendations back in 2009 said that if a parent preferred to have the combination vaccine with MMR plus varicella, and the risks were explained, that the child could receive that vaccine. So it was their decision-making, parental choice that was in the CDC guidelines established in 2009. That's what was overturned by the more recent ACIP, basically taking away that shared decision-making and that parental decision. That's the story behind combination with the MMRV. The MMRV vaccine is still recommended and offered for the second dose in children older than 4 years of age because the risk of febrile seizures in that age group is just very, very.
So it feels like the administration has gone a step further than that by saying we should split MMR into 3 separate shots, which I understand is given multiple times to children.
Yes, the MMR vaccine is given twice. So it's given here in the United States, it's given between 12 and 15 months of age, and then it's given prior to school at 4 to 6 years of age. And another irony is that there have been complaints, and this administration has highlighted this, in fact, overinflating vastly the number of injections that children receive. And so obviously splitting out the MMR vaccine into 3 separate shots just increases the number of injections. So it almost seems counter to what they seem to stand for. And there's no scientific basis to separate out the MMR components into separate vaccines. That combination vaccine works very well, it's very effective, and it's very safe. There are a number of advantages to combination vaccines. First, to the child gets fewer injections. And I know that is of concern to some parents. And so you reduce the number of injections by giving a combination vaccine. For the parent, you have fewer healthcare visits. You don't have to go back to your pediatrician's office or your nurse practitioner's office to get the individual vaccine. So that can save time and money. For the practitioner themselves, it saves time and money. There's less nurse time to administer the vaccines if you're giving combination vaccines. There's less storage space for your vaccines if you're given combination vaccines rather than having separate vials for each individual vaccine. And then on the public health perspective, you get higher coverage because anytime you break a vaccine up into multiple components, there's a probability, a likelihood that the child's not going to be brought back for the second dose in the case of MMR.
Giving those all together can improve immunity. Is that right?
I think a child would be protected by the monovalent vaccines as well. But we don't have a lot of experience. There is a lot of experience globally with the monovalent measles vaccines. Some countries, even now, just use the monovalent measles vaccine. There's been a big push globally to combine that with rubella as part of rubella control and elimination efforts. So most countries at least give the MR vaccine. I don't know of any country that, I don't even think it's available, would be a monovalent mumps vaccine.
So I wanted to talk to you about a point you brought up earlier, which is that there's no monovalent vaccines available in the United States. So what kind of process to get those approved?
Vaccines are the most rigorously evaluated product we have, and that's because they are given to healthy people. So we have very low risk or tolerance for adverse events. What would have to happen if we were to have the monovalent vaccines licensed and approved by the FDA and approved by the CDC here in the United States is vaccine manufacturers would have to fund studies of those monovalent vaccines to look at probably immunogenicity. I don't think they could look at efficacy because incidence of these diseases is too low to really do an efficacy study. You'd need a huge study to look at vaccine safety. Now, some of the messaging that's coming out of the Department of Health and Human Services is that vaccines should undergo placebo-controlled trials. That would be extremely difficult with monovalent measles, mumps, and rubella vaccines because basically it would be unethical to withhold a well-established vaccine like MMR, the combination vaccine, and give a child a placebo. So the way I read this is that this is a way to undermine the confidence in the MMR vaccine and to basically put up almost insurmountable barriers to have monovalent vaccines.
Mm-hmm. So it's impractical, it's impossible to study, and it would start you back at the beginning of the FDA review process, which could really put a wrench into childhood vaccination as we know it.
Exactly. Now, we have to be clear that, the statement wasn't that we should remove the MMR vaccine, from the childhood immunization schedule, although it's hard to tell what's going to happen with upcoming ACIP meetings, and they are going to be looking at the childhood immunization schedule. So it's not clear how this is going to move forward. We know that Merck pushed back on the call from the acting CDC director.
They make the MMR combination vaccine.
Yeah, they make the MMR combination vaccine. Exactly. And I'll just have to say, Stephanie, that, I think it's worth reviewing briefly what exactly President Trump said. He said, and I have his quote in front of me, "The MMR, I think, should be taken separately. This is based on what I feel." And that's just not how we make rigorous vaccine policy.
And as you said, you thought this might go away because it did not include sort of any data or anything like that. But then the acting CDC director came out and sort of doubled down on this.
Yes, Jim O'Neill, the acting CDC director, basically quoted President Trump in his tweet. And again, this is vaccine policy by tweets, where he quoted President Trump and said, quote, "break up the MMR shot into 3 total separate shots." He didn't even use his own language. And again, there's no evidence to support why that would be advantageous.
That was going to be my next question to you, though. The why. So why are we here? We're talking about discredited information from decades ago, a lack of scientific evidence.
Yes, and it's a great question that I ask myself. How did we even get here? How did we get to a point where the president is making this claim that the MMR vaccine should be given in 3 separate shots? And I can only speculate. I don't know the reason why. There certainly is no scientific evidence to suggest that there's any benefit in doing so. In fact, as we've discussed, there are disadvantages to not using the combination vaccine. So I kind of read this as part of a broader effort to undermine confidence in vaccines in general, and particularly the MMR vaccine, which, as we said, has this long history of falsely being associated with autism. I fear that this attack on vaccines, and again, specifically the MMR vaccine, is going to get worse before it gets better. And it just comes at a very unfortunate, tragic time here in the United States, where we have more measles cases this year than we've had since 1992, and certainly since measles was declared eliminated in 2000, and where we're very likely to lose our measles elimination status come January 2026 if we've had a year of transmission of measles virus.
Before we close, I wanted to remind people that the vaccination is like the number one greatest achievement of public health.
Yes. Along with, clean water and sanitation, vaccines have been tremendous in terms of preventing disease and deaths here in the United States and globally. Last year was the 50th anniversary of the expanded program on immunization, now called the Essential Program on Immunization, which is the global vaccine. And it was estimated that vaccines saved over 150 million lives. So they are one of our greatest public health achievements. I would say one of our greatest achievements as humanity in terms of controlling disease, eradicating smallpox, nearly eradicating polio. It's one of our greatest achievements, and it's very disturbing to see the vaccines undermined here in the United States. And the only way that can happen is because people don't see these diseases because of the success of vaccines. It's just an example of how the success of vaccines really undermines itself by making these diseases go away, and then people don't worry about them.
Bill Moss, thank you so much for your time.
Thank you, Stephanie.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.